Welcome to today's Explainer. We are jumping right in to unpack one of the ultimate medical mysteries of our time. It's a massive paradox that has frustrated doctors, patients, and researchers for decades. We're talking about the deeply complex, often misunderstood, relationship between your genetics, your daily lifestyle, and your actual risk of developing cancer.
So why does the healthy non-smoker get lung cancer, while the chain smoker lives cancer-free? It's a scenario we've all heard about, right? Someone who exercises, eats perfectly, and barely even looks at a cigarette gets a devastating diagnosis. Meanwhile, someone who smokes a pack a day for 50 years never develops a tumor. It seems incredibly unfair. It seems completely random, and honestly, it's highly confusing. But as we're going to see today, it's actually not random at all.
Here is our roadmap. We'll start with the great cancer paradox, uncover Knudson's two-hit theory, and explore aging and cellular senescence. Then we'll get into lifestyle triggers, reveal the Swiss cheese defense, and outline some proven prevention strategies. Okay, let's dive into this first part, the great cancer paradox, genes versus environment. The core truth here is this: inheriting a cancer gene does not mean your fate is sealed. We know today that there are specific genetic mutations, like the BRCA gene, for example, which highly predispose individuals to breast or ovarian cancers. But the absolutely crucial point to remember is that having this genetic anomaly only sets the stage. Even if you're born with a mutated gene inherited from your parents, that alone is usually not enough to spark the disease. Your genetics might build the foundation, sure, but something else has to come along and finish the job. So, what exactly is that something else? Let's move to Section 2, Knudson's two-hit theory and how it really begins. Back in the 1970s, an American geneticist named Dr. Alfred Knudson was studying a type of eye cancer called retinoblastoma, and he noticed a really stark, fascinating difference in his patients. In cases where the cancer was hereditary, meaning it was passed down through the family, it appeared very early in a child's life and often affected both eyes or showed up as multiple tumors. But in the non-hereditary cases, the cancer appeared much later in life and almost always in just one eye. This distinct difference in timing and severity sparked a massive realization that literally changed oncology forever. That realization led to the two-hit theory. Basically, cancer generally requires at least two mutations, or two hits, to a cell's DNA before it can actually develop. If you inherit a genetic mutation, you're essentially born with the first hit already in place. But you still need a second hit to a healthy gene to trigger the cancer. And this second hit, it almost always comes from some coincidental environmental factor later in life. This perfectly explains the wildly different patterns we see in patients. Hereditary cancers have an early onset because the patient is already halfway to the disease the day they're born. They just need one more accidental hit. But non-hereditary cancers, a person is born with completely healthy, intact genes. For them to get cancer, they have to accumulate multiple accidental hits over their lifetime. In fact, for some non-hereditary cancers, it takes not just 2, but sometimes up to 8 separate genetic mutations accumulated over decades for the disease to finally develop. So where do these daily accidental hits actually come from? Section 3, aging and cellular senescence. As we grow older, our cells age and decline right along with us. Generally, they meet one of 3 biological fates. The first is apoptosis. This is healthy programmed cell death. The cell realizes it's old and just quietly removes itself. The second fate is exactly what we're trying to avoid, cancer, where the cell mutates and begins this infinite, uncontrolled division. But the third fate is incredibly fascinating. It's called cellular senescence. To prevent becoming cancerous, an aging cell might actually turn into a zombie. It doesn't die, but it stops dividing. But here's the major catch. These senescent zombie cells constantly secrete inflammatory substances into your surrounding tissue. This chronic inflammation acts as a persistent stressor on your healthy cells, and that dramatically increases the likelihood of taking those dangerous genetic hits as we age. But aging isn't the only thing causing these hits. Let's look at Section 4, lifestyle as cancer triggers, and what actually pulls the trigger. We really need to break down the biological chain reactions caused by these specific habits, because it's not just about them being bad for you. Take smoking. It actively introduces radioactive polonium and highly carcinogenic nitrosamines that directly mutate your DNA and suppress your tumor-suppressing genes. Then we have alcohol. Inside the body, alcohol converts into a highly toxic substance called acetaldehyde. What's surprisingly relevant here is genetics. For instance, about 50% of the Japanese population actually lacks the enzyme to efficiently break this toxin down, which leads to a much higher risk of cancer from drinking. Finally, obesity and a lack of exercise. Carrying excess weight causes spikes in insulin and a hormone called IGF-1. That aggressively promotes cellular growth, which unfortunately includes cancer cell growth, while simultaneously causing steroid hormone imbalances that lower your immune system. And of course, human nature being what it is, these things rarely happen in isolation. When you combine the chronic inflammation of stress with stress-eating carbohydrates, heavy drinking to cope, and smoking, you are creating an absolute perfect storm. You're actively flooding your body with oxidative stress. Essentially, you're creating unstable, active oxygen radicals that bounce around and bombard your cellular DNA with those dangerous hits we talked about. But here is the wild plot twist of our explainer. Section 5. The Swiss cheese defense, your body's incredible shield. You have to see how incredibly hard your body fights for you every single second. First off, your body naturally produces antioxidant enzymes that neutralize the vast majority of cancer-causing active oxygen. If some escapes, you have a second layer, uric acid. Now, uric acid is usually blamed for gout, but in times of high stress, it actually acts as a powerful neutralizer against hydroxyl radicals, which is a highly destructive form of oxygen. If a radical still manages to slip through and damage your DNA, step 3 kicks in. DNA repair enzymes rush in to fix the mutated code. And finally, if a cell actually does become cancerous, step 4 activates. Your cellular immunity acts like an internal police force, hunting down and destroying that newborn cancer cell before it can multiply. This brings us to a brilliant analogy used in safety and medicine known as the Swiss cheese model. Think of your body's defense systems as a stack of Swiss cheese slices. Each slice represents a defense layer. The antioxidants, the DNA repair, your immunity. Naturally, each slice has holes or temporary weaknesses, but the absolutely crucial takeaway is that cancer does not happen from a single failure. Cancer only occurs when the holes in every single slice of cheese align perfectly, allowing the hazard to pass all the way through unchecked. You have to overwhelm literally every single barrier your body has to finally get sick. Now, when those barriers do fail, modern medicine is stepping in to help patch the holes. In the past, doctors had to rely on broad, generic chemotherapy based purely on where the cancer was, like the lung, stomach, or colon. Today, though, we are entering the incredible era of tailored precision medicine. If you have a specific mutation, like a KRAS gene mutation in lung cancer, doctors can now prescribe custom drugs that specifically inhibit that exact genetic flaw. It's a massive leap forward. However, patching the holes before cancer develops remains our absolute most powerful tool. Which leads us straight to our final section today, Section 6, Proven Prevention Strategies, and how we actually patch those holes. These are the scientifically proven lifestyle interventions that fortify your body's shields. First, quitting smoking entirely. This eliminates the heaviest bombardment of DNA damage right out of the gate. Second, limit alcohol. A great rule of thumb here is to avoid habitual at-home drinking. If you aren't dependent, an occasional social drink out with friends is totally fine, but daily home drinking really strains your enzymes. Third, weight loss. This directly lowers those dangerous insulin spikes and balances out your hormones. Fourth, aerobic exercise. It's not just about fitness. It actively reduces the risk of cancer, heart disease, and dementia by keeping your cellular metabolism healthy. And, finally, ensure your vitamin D intake is adequate. There is currently a mountain of scientific evidence supporting vitamin D's role in cancer prevention. I want to wrap up today's explainer with a thought that perfectly hits the nail on the head regarding the mystery we started with. Genetics may load the gun, but your lifestyle pulls the trigger. Even if you have a family history that loads the deck against you, or even if you lack a certain genetic predisposition, it is ultimately the daily accumulation of environmental hits that dictates your fate. You are not just a passenger to your genetics. Through your lifestyle choices, you have the profound ability to keep the safety on, fortify your body's defenses, and live a long, healthy life. So what habit are you going to change today to patch up your body's shield? Thank you so much for joining me, and keep learning.